Picture this. In a world chasing youth with gene therapies, blood transfusions, and luxury longevity clinics, one of the strongest candidates for a real anti-aging pill is a generic drug that's been sitting on pharmacy shelves for decades. It's called Metformin. It was never meant to fight wrinkles, it was built to fight type 2 diabetes. So how did a cheap diabetes drug become a legend in the longevity world? Is this science, hype, or a dangerously oversimplified story? 1. A bitter plant, a boring drug, and a strange signal. The story begins long before biotech and Silicon Valley. For centuries, healers in Europe used a plant called Galega officinalis to treat what we now recognize as diabetes. Chemists eventually isolated and modified its active molecules, creating a class of drugs called big wowinides. One of them survived the test of time: Metformin. For decades, Metformin was the quiet workhorse of endocrinology, cheap, effective, first-line therapy for type 2 diabetes. Then, researchers started to notice something odd. When they looked at huge medical databases, they saw hints that some people with diabetes taking Metformin were living longer than people without diabetes and had less heart disease and less cancer than diabetics on other drugs. That's not how chronic disease is supposed to work. Either the statistics were lying, or Metformin was doing something much bigger than just lowering blood sugar.
What Metformin actually does inside your cells. At the textbook level, Metformin makes your body more sensitive to insulin, tells your liver to produce less glucose. That alone is already huge for people with diabetes. But zoom in further and the story gets weirder. In lab studies and animal models, Metformin appears to activate AMPK, a cellular energy sensor also triggered by exercise and calorie restriction. It reduces chronic inflammation and oxidative stress, protects blood vessels and possibly brain cells. In other words, it seems to push cells into a state that resembles healthy stress, using energy more efficiently, cleaning up damage, staying a bit more resilient. That's exactly the kind of biology aging researchers dream of targeting. This is where the big idea comes in. Maybe Metformin isn't just a diabetes drug. Maybe it's a geroprotector, a drug that targets the biology of aging itself. But dreams are cheap. Clinical data is not. 3. Longevity data. Promise, confusion, and controversy. On paper, observational studies look exciting. Across many analyses, people with type 2 diabetes on Metformin often show lower all-cause mortality than diabetics on other therapies, lower rates of cardiovascular disease, lower risk of some cancers, and in some models, even better survival than non-diabetic controls. That's where the youth pill headlines come from. But here's the problem. These are not perfect randomized trials. They're messy real-world data sets where doctors may prescribe Metformin to slightly healthier patients. Sicker patients may be switched off Metformin to other drugs. Lifestyle differences are hard to fully adjust for. And when researchers stretch the follow-up out to 15 to 20 years, a more sobering picture appears. People with diabetes on Metformin may have an early survival advantage, but over the long run, the underlying disease still catches up. Their lifespan ends up shorter than truly non-diabetic controls, even if Metformin still looks better than some other diabetes drugs. Another long-term study following high-risk patients for over a decade found that Metformin helped delay diabetes, but did not clearly reduce overall mortality compared to placebo. So, does Metformin extend life? Right now, the fairest answer is, we don't know. What's more plausible today is this. Metformin might extend health span, the number of years we stay relatively healthy, especially in people with metabolic risk. But that's still a might, not a guarantee, and it definitely doesn't make it a magic pill for everyone. 4. The TAME trial, a moonshot for aging. Now we get to the boldest experiment, the TAME trial, targeting aging with metformin. Instead of asking, does metformin lower blood sugar? TAME asks, can metformin delay the big diseases of aging as a group? The plan is to enroll about 3,000 adults between 65 and 79 years old, all without diabetes, and randomize them to metformin or placebo for several years. The main endpoint is not a single disease, but the time until someone develops any major age-related condition, heart attack, heart failure, stroke, most cancers, cognitive decline, dementia, or dies. If TAME shows that metformin can push that first event further into the future, it wouldn't just be a win for this one drug. It would be a regulatory breakthrough, proof that you can design and approve drugs that target aging itself as a common risk factor. But there are catches. Aging is not officially classified as a disease. Regulators and funders are cautious. And as of today, TAME has faced delays and funding challenges and is still not fully up and running. So, metformin sits in this strange limbo. Too promising to ignore, not proven enough to crown it as an anti-aging pill. 5. The fine print. Side effects and real risks. In the middle of all the hype, it's easy to forget a basic fact. Metformin is not a vitamin. It's a prescription drug. Common side effects include nausea, diarrhea, stomach discomfort, loss of appetite, a metallic taste in the mouth, especially at the start of treatment. Long-term, metformin can reduce absorption of vitamin B12, which can lead to anemia and neurological symptoms if no one is checking your levels. And then there's the rare but serious complication everyone worries about, metformin-associated lactic acidosis. It doesn't happen often, but when it does, it's life-threatening. It usually appears in people who also have kidney problems, liver disease, serious infections, dehydration, or heavy alcohol use. This is why most medical experts agree on one thing. Metformin should not be used as an anti-aging pill in healthy people. There's not enough evidence, it's not approved for that purpose, and the risks are real. If you have diabetes or prediabetes, metformin might be a great option, or it might not. But that's a conversation for you and your doctor, not a YouTube video or a TikTok trend. 6. So, do we already have an anti-aging pill? Maybe we've been asking the wrong question. Instead of, will metformin make me live longer? A better question might be, can we treat aging itself as the root risk factor behind most major diseases? Metformin might turn out to be a first-generation geroprotector, a proof of concept, not a perfect solution. The drug that opens the door, not the one that walks us through the whole hallway. In the end, the best proven anti-aging interventions still look annoyingly low-tech. Moving your body regularly, sleeping better, eating in a way that your future self will thank you for, managing stress, staying connected to other humans. None of those come in a blister pack. None can be patented, but they all rewrite how your body ages. Metformin might get its heroic headlines someday. For now, the honest story is more nuanced. We don't yet have a magic pill against aging. What we do have is a new way of thinking. Aging is not just a fate. It might be a target. And if that turns out to be true, then a cheap, bitter diabetes drug from the last century could be remembered as the spark that changed how medicine thinks about time itself. This is Xpress Curiosity. Thanks for watching, and for questioning the future, one pill at a time.